Hi, everybody. I'm here with Dan Fetterspill. He is a talent acquisition consultant at IU Health, and he's going to answer a couple questions and give us some more information on his great organization. Thank you for being here.
Thank you for inviting me, Brandy.
My pleasure. Can you tell us and give us kind of a little background about IU Health and the work that you guys do and what you're looking for?
Yeah, so IU Health, we are the largest hospital system in the state of Indiana, and we are also one of the largest teaching hospitals. And we are considered a magnet hospital, which means we've demonstrated excellence in patient care and nurse innovation. So we have a very good reputation nationally because of this, and we are one of the very few hospital systems in the state of Indiana that have that status as well. And so since we're such a large organization, we have roughly 34,000 employees statewide. So there's always going to be positions that are going to be opened and filled throughout the day. And we also post our positions in real time on our careers portal, which is www.iuhealth.org/careers. And from there, you'll be able to do a keyword search and as well as a zip code search to find positions within your area. And for example, if you're interested in working in like the ICU or in pediatrics, you can simply type in whatever patient population you have an affinity for, and we can match you with those applications. So we have all sorts of inpatient, outpatient, business solution positions, as well as clinical, non-clinical openings that are not related to RN openings as well. So we have a lot of options, especially for new grads as well.
Nice. And what about internships? Do you have an internship program?
So we don't, we typically have internship programs that are geared toward non-RN, non-clinical positions. I don't have knowledge of it right now about what internship programs we have, but as of right now, we don't have any like nurse internship opportunities available right now.
And then what about part-time work for somebody who might be in nursing school or interested in gaining some experience?
Yeah, absolutely. So we do have what we call PRN openings. It's for patient care advocates. So if you're currently in college, you haven't graduated quite yet, then we do have PCA options available for you. And we call it PRN because you would be expected to work at least 24 hours over a 6-week period. So it's very flexible. It is, I guess I would consider it part-time, but it's more supplementary.
Okay.
So that's great. It's a great option for college students who haven't graduated quite yet, but want to get some experience before their graduation.
Perfect. And what do you look for when you're hiring a candidate?
Yeah, so there are quite a few things that we look for. One thing that I'm kind of a stickler about is punctuality with time slots regarding interview times. So right now with COVID-19, of course, we are doing a lot of virtual interviews. I do a lot of phone screens and phone interviews as well. So as long as they are able to communicate with us and respond back to our emails regarding any kind of time slots with interviews. And if they do show up and if they are punctual, like I said, with their time, that's very beneficial. And simply because we have such high volume right now with students and with candidates, if we don't hear back from anybody, if there are no call, no show to their interview, unfortunately, we have to move forward with other candidates just because of the volume. So yeah, we're looking for those who are punctual with time for sure.
Perfect. And then what about career growth opportunities once you're part of the IU Health Network?
Yeah, so what's really great about the growth initiatives that we have in place is that we have what's called a patient care resident program. And I'll just go ahead and read off of a little blurb of what we have to offer. So, and this is in terms of career growth. So nurses will typically ask about residency programs or internships. So ours is called the Transition to Practice. And it's a great educational support system for new nurses. And the benefit is you're hired into a specific unit of your choice. And you go through a 10 to 12 week orientation on that unit. And after orientation is complete, you'll go through a year-long program that's designed for new graduates, or if you have less than 6 months of experience. And you meet every other month, and you meet with nursing leaders and mentors, and it's a learning support group. And there's going to be dialogue about educational offerings. They'll talk about experiences that they've had on the unit, and they'll also help with nurse and physician interactions, as well as conflict resolutions, and also career development because of the networking aspect of this. And it's a very important support system to help bridge the gap from student to professional. And they also provide emotional support, which we call critical incident debriefing sessions. And it's like grief counseling. If you lose your first patient, they'll help you learn how to move on, move forward. And that's excellent for your career growth as well.
Mm-hmm.
Does that answer your question?
It does. Yeah.
Okay, wonderful.
That's a really great, I keep taking, I'm trying to like keep all these, I know it's being recorded, but I'm still like trying to feverishly take all these notes about these great
Yeah,
things
no
that
problem.
you're telling us about. If somebody is interested,
Mm-hmm.
what would their next steps be?
Yeah, so the first step would be to apply for a position. We have a few openings as well that are evergreen requisitions. It's like a catch-all position that's posted for new grads. But really, if they just put in one application, we are required to reach out to our applicants within 24 hours, whether they're eligible or not. And so once they put an application, either the recruiters, talent acquisition consultants like myself will refer applicants to each other because there's many of us. But once they put an application, that's their foot in the door, and they'll be able to move about the company within interviews and everything. So the first step is to always just apply for position. I always recommend that seniors will maybe apply to like 5 or 6 openings just to cast a nice wide net so they are keeping their options open. And then once they've submitted an application, they should be receiving a call or an email from a recruiter or talent acquisition consultant. We're the same people. And then we will schedule a phone screen. And as long as they show up to their phone screen and they're punctual, and they can talk about themselves, they exude passion, then we can figure out what to do with you. And after that, there'll be virtual interviews with hiring managers and maybe a shadow as well. Hopefully our COVID-19 restrictions will be released by the fall. That's the goal. But yeah, that's kind of the timeline.
Okay. And then if somebody who is non-nursing in some of those business positions that you might have talked about earlier, same kind of thing, apply for the position. Okay.
Absolutely.
And then what about, do you work with international students or hire international students?
So as of right now, we cannot provide any sponsorship for international students. They must be a legal resident of the United States.
And then what about relocating? There's IU Healths all over. So if they apply, do some of the job postings say specifically where and what region they would be applying for?
Yeah, absolutely. So the regions, the locations are always listed on the openings, on the requisitions. Now, if a candidate is hired with us, they must be employed with us for at least 6 months until they can post out into different positions or locations within IU Health. And we have several locations throughout the state of Indiana.
Perfect. Those were all of our questions for you. Is there anything else that you wanted to share that you didn't get to share through those questions?
One thing that I always like to let students know is there is a little bit of a stigma behind working as an RN in med-surg, like a medical surgical unit. They think that it's not necessary for career development, but it's very, very important. It's a very important stepping stone to pour the foundation of your career. And you'll learn all kinds of skill sets. It's such an important first step to go into. So I wouldn't rule out med-surg ever if you're a new graduate. Spending at least 6 months to a year in a med-surg unit can be very, very beneficial for the long term. When they're eligible to transfer out into an opening or a patient population or units that they have an affinity for, their hiring leaders in those units will see these candidates as assets because they come in with a wide variety of skill sets backed up with a very strong professional foundation that they've poured. Just don't rule that out. RNs will be working as nurses for decades and decades after passing their boards. It's not a bad idea to start from the very beginning and work in a unit like med-surg for a few months and just to chisel your nursing student chops as well. nursing school chops, as I should say. So that's kind of all I have to provide with advice. Yeah.
Yeah.
Hmm.
Okay, well, we thank you for your time. We didn't want to take up too much of it. I know that you are super busy with all kinds of things
Just a
in
little
the
bit.
in the hospital world, but we wanted to thank you for your time.
All right. Thank you so much, Brandy. Have a great rest of your day.
Thanks.